Welcome. I'm very happy today to inform you a little bit about our Weight Doc program, a special online service for the specific problem of young adolescents and young adults with anorexia nervosa, both for young women, girls, and young men and boys. This program has been running for the last 2 years. We started at the beginning of the pandemic when these patients unexpectedly found themselves without therapeutic team support when they had been dismissed from their hospital settings, and we were kind of forced to invent a program to ensure their physical safety, but also to offer an effective alternative to get well in their homes, at that time still during the lockdown, and a new model was developed. The three main principles of these models are: we are in contact with the patient herself and himself on an individual and protected area. This means that the written contact and maybe also Zoom contacts between the patient with anorexia and one of our 3 team members taking care of this patient is individualized, and parents don't know what exactly is written between the therapeutic team and the patient. This is very, very important because autonomy and self-esteem and trusting in your own abilities is one of the deficits which patients with anorexia nervosa develop. All the more we find it crucial that the therapeutic process is also developed on an independent level. The second team which has to be supported are, of course, the parents and the family. Here the level of suffering is sometimes even more than the suffering of the patient himself or herself, because the problem has often been going on for months or even years. These families are utterly exhausted, are utterly desperate, and really need support to find their own strength again and stop trying to solve the problem of their daughter or son. That's one of the basic first tasks, to kind of sort out who has which problem and with which means can who help whom, and with which behavioral habits is who preventing progress to happen. The third contact person is the local either paediatrician or general practitioner of the child, and here we must find a medical colleague who is prepared to weigh the patient once a week, and in the assessment phase also discuss, depending on the severity of the BMI, whether additional medical blood checks or examinations need to be made before the treatment can start. We don't have any lower side BMI which excludes the Weight Doc program, but we don't advise to start below BMI 12. In individual cases, we are very much prepared also to discuss exceptions, but usually our patients are with us in the program between about BMI 12 to 14 starting, and we support them up to a BMI up to about 18 to 19. The duration of this program is after the assessment phase, which lasts about at most 1 week, between 3 days and 1 week. We are in daily intensive contact, also on weekends and also on holidays. And the average duration is about 3 to 4 months, after which the program can be prolonged on a monthly basis for basically as long as the patient and or the families wish this to receive our follow-up. The weight question has to be discussed, and usually we advise a weight gain goal to be defined, which is composed of a weight gain, a weekly weight gain of about 350 to at most 500 grams a week, which means a daily weight gain of 50 to 70 grams a week. To do it much faster is hardly ever possible, and to do it much slower is really not moving. And without moving, we risk developing chronic anorexia nervosa, and this really lowers the long-term prognosis, and we try to put all our efforts and all our persuasion strength into trying to prevent that to happen. So whatever age your child is, please try and get in contact with us as soon as possible, and we assure you to take your case individually serious with 4 decades of clinical experience with anorexia nervosa in all different kinds of settings. And of all options we have been through, I must today nearly confess that I think that the online model is one of the very best we have. One of the main and convincing benefits of the online program is that the young adolescent or young adult is at home. It is in the surrounding where the illness started, where the illness developed, and where the complexity of problems which led to the development of anorexia also has to be solved to move out of it. This cannot be done in a hospital setting where the family is not around. By involving the natural surrounding of each young patient, this means the parents, the grandparents, the siblings, being at home with their pets, being at home with their friends, being able to go to school, all this helps to solve the anorexia problem by achieving their life back again in a much, much shorter time than any hospital environment can actually offer this. So please contact us. We assure you that we go through the assessment of each patient very carefully. We read the medical reports which have been collected in the months up to now, and we will give you an honest estimation about the question of suitability and whether we recommend to start the online program right now, wherever you live.